Good evening and thank you for tuning in. This is The Nest on Y254 TV. I am your host, Loreen Kerubo. Do catch up with us on our social media pages. That is Loreen Kerubo for Instagram and TikTok, and Y254 TV for Instagram, Facebook, YouTube, and TikTok. Tonight's episode is one that is encouraging. It's all about empowering vulnerable communities. We are talking about restoring dignity, supporting families, and creating opportunities for young mothers and children in marginalized communities. And joining me on set to dissect this topic is an amazing individual known as Isaac Nangondia. He is a 46-year-old professional, a CEO and executive director of Pendle Kamili CBO. Aside from that, Isaac is a pastor at heart and a seasoned social worker. He brings on board 17 years of amazing experience. I'm talking about almost 2 decades into this career. Karibu sana, Isaac.
Asante, Loreen.
It's an honor to have you on board.
Thank you.
Yeah, let's talk a bit more about yourself. Tell me, who is Isaac Nangondia in your own words?
Thank you. As you mentioned, my name is Isaac Nangondia.
Yes.
I was born and raised up in Turkana.
Yes.
Both of my parents are Turkanans. Yeah, they live in Turkana. Also, I was born in Turkana, in a small village called Lorenge Loop. Lorenge Loop.
Okay.
Lorenge Loop is in Turkana County, in a constituency called Turkana Central, and in a location. Lorenge Loop is a location and under called Kerio Division.
Kerio Division.
Yeah.
Nice. How many siblings did you have?
My father is a polygamous man, and my mom had a privilege of being the first wife.
Wow. Okay.
And we are 7 of us but we have other 20 siblings.
So 7 are from your mom?
Yes.
And then there are other like 20 more?
20 more.
From the other wives?
Yes.
Okay, yeah. Nice. So what are the challenges you experienced growing up? How was your journey growing up from primary to, how is it?
There's been a lot of challenges. Turkana definitely being a marginalized community. One of the greatest challenges has been like food, because we were struggling to get food, but majorly a lot of times we ended up in relief centers and meeting people who can help. And then school was also a great challenge, because majority of the marginalized communities do not value education. They allow their children to look after animals, and it means like in that community that education is retrogressive. It's like it changes culture, so the community does not allow their children to go to school. But through the government initiatives during the Moi era, it was like either the chief will come to a family and then comes and decides that out of like you have 15 children, maybe send 2 to school, because it was a government initiative to ensure that the marginalized communities allow their children to school.
Nice. I'm glad you've talked about the government. So just to understand your growth and your childhood, when you were born, did you get to experience the chance to go to school immediately, or when did you at least attain like proper education?
So the advantage that I had during the time I was born, we had a missionary from America who came to our village and doing evangelism, and out of that we started through that the family used to do homeschooling for their children, and we became friends with those children. Then I got excited to go to school.
Wow.
Otherwise it wasn't something that was interesting for me to go to school.
So how did your earliest experience with this hardship create resilience in you to like be who you are today?
Personally, it's life. I think from the community mindset, it's like life is just challenging. And it's build resilience that with all those challenges, you can overcome it, you know, and like without school fees or lack of motivation from parents to do or pursue things in life, and And it built resilience in myself just to basically say you can able to overcome challenges and rise above those challenges.
Yeah. So now, were all of you able to go to school? Because now 7 + 20 is like a huge number. How was school like for you? What was that experience entirely? Not just early stages, but still your, let's say, your teenage years. Yeah.
I think school to me, it was my personal initiative. It wasn't my parents' initiative.
Okay.
So and then number 2, I received support from the family I told you that I met with them. So and then they kept on encouraging me, inspiring me.
Yeah.
It wasn't, I didn't bring a report for parents to see or parents coming to school or just checking out my performance. It was personal resilience.
So if you fail, nobody's coming to confirm.
No.
You're not taking results.
No. You go, it's your thing. So,
okay,
yeah.
So you really have to push yourself to have the self-discipline.
Exactly.
And a fire burning inside.
Inside yourself, like, that's it.
Yeah, so were there mentors during this experience? You've said your family wasn't really much into it. Are there people in the community who really helped you through this?
Yes, yeah, majorly, a lot. That missionary family was a big pillar. Number 2, I also had community leaders who were coming alongside myself, like the area chief and maybe some big people who are seeing like, hey, this guy is resilient, and the commitment and the performance I was doing in
There's
school.
something about Isaac.
We need to build this guy up.
Amazing. So at what point did you realize you can be an advocate of the marginalized communities?
I think after finishing school, I came up and joined, I think went to several schools. There's St. Paul's University. I did leadership and management. Also, I went to Bible school, and all those coupled up those things. And I realized who should be an advocate. It's someone who comes from that, what marginalized community understand, what are the challenges they are facing, and sharing that resilience out of, not from a place of being told, but place where you've experienced.
And it's also better to talk about it when you've worn the shoe and you know how the shoe fits.
Exactly.
Looking back, what lessons do you feel you picked from your childhood experience that molded you into who you are today? What is a major lesson that carries you through? One
major was faith.
Faith.
Yeah, faith was the major one, because I trusted in God when even things were beyond my own human understanding. That was the biggest one, because trusting in God has been able to help me to move through every ladder, every challenge. Number 2, it's the component of believing in what God has called you, or believing in yourself. I think that those 2 things were very great lessons for me.
So now we've finished school, we've gone to the university, we've done leadership. How did we come up with being an executive? How did we come up with the foundation of Pendo Kamili?
Well, I've worked. I started working for 17 years, as you mentioned. I worked in the slum majorly, Madare slums, and for those 17 years. Then traveled in different parts of Kenya, majorly in disadvantaged communities, places like Kwale, Kilifi. Traveled to places in Kisumu, different parts, and just seeing challenges and sharing my story and trying to build that resilience. So I also felt like I also wanted to give back, because I traveled back home, call people, take them to...
I was even about to ask that.
Take people home and ask them what home looks like, how our home is. We don't have very fancy houses, but that's where I was born, and then I'll take up people there and take them for missions and just see and share my story, and people getting encouraged. Out of that, I felt like I think there was much more just beyond employment. So that's when I felt I need to begin an initiative to lead people to help.
Amazing, amazing. Your dad must have been very proud of you, going back and giving it back to the family.
So many times.
And your siblings do learn a lot from you.
A lot.
Amazing. Let's talk about the foundation itself. You work with empowering women and young children. how did you come up with these categories, or what are the categories in Pendo Kamili? Like, what programs do you have?
One of the things that inspired me is the component of, if someone wasn't able to help me at the time I was growing up,
Yes.
and encourage like that family, a missionary family that came into our village and gave me resilience to see that there's possibilities in myself, and also believing in a chance for myself.
Yeah.
I felt like change can only happen if you impacted families. And I believe and I truly confirm that you need to identify families, and so that's exactly how Pendo Kamili began. So I went up to the area chief in that Kiambio community in East Lee area, talked to them about how we can identify needy families, and then work with those families. And those families have to have some criteria, like the struggles they are going through.
Okay, so it's not just all families.
Not just all families. No.
That's a good thing.
Yeah, we identify economical challenges.
Yeah.
We also check on the spiritual challenges, and then challenges about lack of knowledge, economic empowerment. We assess those issues based on the assessment that I do for those families. So I identify 55 families.
Wow.
That I work with.
That's a lot.
Yeah. And then I bring children on Saturdays, where we feed them every Saturday. Then also we meet with families. I do on visit to their families, talk to their families, then want to setting up economic empowerment programs. And then we do every time we give what we call chakula cha upendo. I think like
chakula cha upendo.
It's like a food basket. So we give food baskets.
Okay,
so food baskets is because families are struggling in the slums to meet food and meet needs. So I invite friends, and then friends give food, like 2 kgs of uga, 2 kgs of cooking, or maybe oil, all those. Then we put it in a package. Then we give as chakula cha upendo.
Wow. That is amazing. And I'm glad that you're also bringing in your friends and you're doing this thing as a whole team. It doesn't have to be guys from your actual community.
Exactly.
People from different areas.
Yeah.
Okay, so what's the overall approach when you're handling vulnerable women and children? Specifically for women and children, what's your approach with them? Because we have widowers, we have single mothers.
Yes.
Have you gotten to experience such families?
A lot, actually.
A
lot.
Yeah.
Actually, the most affected are actually women, because they're the ones you realize that actually, one, in the slum they have so many children, and the women, some of them have no source of income.
Yeah.
And then they're taking care of their children. And then the families have lots of, like, for example, we had a family recently. I think like last year, they have 7 children, and then they got another 1 child. Actually, been like trying to talk to the family, like to do family planning.
So. And in their mind, it's not only baraka, so there's nothing you can tell them. Okay. What are the unique challenges you feel you've experienced with women? Something.
Okay, a lot. There's a lot. Okay, firstly, for women, for children, some of the children I handle with, they have gone through rape cases.
Okay, that's sad.
And then number 2, HIV. It's been a unique challenge in the slums. And then there's a component of prostitution that has also been huge with women in the slum.
So you give education in terms of also medical. You talk to them about how they can take better care of their health as well, because infected people tend to have stigmatization.
Exactly.
You feel like nobody's going to understand you, nobody's going to be there for you, and it's nice to have Isaac who's there to advocate for such families. Is there a special testimony maybe you can share about a woman you've helped, or a child, or a family you've worked with that speaks to you entirely?
I have a child who began with him. His name is Ibrahim. Ibrahim went for, very interesting, the house got burnt, and then they went for an operation for one of the public hospitals, I don't want to mention, and then the operation did not don't go well. So
Okay.
the hand like goes
Had a twist.
A twist.
Okay.
So from that, from last year, I talked to a friend of mine who has an hospital, and then I fundraised money for the child to be taken for. Currently, is going through a process of therapy.
Yeah.
To see the hand corrected and restored. That's one. Number two, there were also just the component in January. There was a donation of food baskets that was given to family. It brought a lot of transformation.
Wow.
We gave food to every family. Every family, 2 liters of soda.
Yeah, that's what I even wanted to know. Like, what does the food basket have?
It's like we bought 2 kgs of cooking oil, 2 kgs of sugar, unga, tissue. Like
tissue is essential.
So it's very basic things, and soap, and we brought those families together, around 55 of those families. It was amazing.
I know, that must have been quite heartwarming.
Hey, that was like transforming,
Yes. So how do you ensure empowerment goes beyond financial help? Because you might not be able to financially come through. How can we restore dignity and confidence without economic empowerment?
I think it's actually, first is the component of able to helping people to know they are seen, they are important.
True.
That's not we are valued because sometimes it's not just the physical help.
Yeah.
My presence, going just to visit those families, it's something that's transformed them, that they can rise up and do something, and believing in people, because people in marginalized communities think like they have nothing to offer in life. But being just able to believe and telling them you have something to live in or live on, just beyond just a fan. And that's why I wake up every day and go there and serve them. And I tell them I don't have money, but I'm here with you. And they will call me and I'm like, this problem has happened, and go out counseling them, talking to them, visiting them. That's it.
Wow. And I like what you've said. In as much as you don't have something to give, you're giving your service.
Exactly.
And that is a lot. Because we've had families who've probably never even experienced a visitor. And if they have, it has to be a family member or an old-time friend. To have a stranger who's picked you up as a family, as your own family, and taking good care of you, that to that extent shows how amazing and how dedicated your work is needed in this country.
Exactly.
How do you measure success with women and children?
One, I think like change of behavior. That's one of the great measure to me.
Yeah.
Because like, for example, like working with families to reduce alcoholism, handling drug abuse, or working with families dealing with conflict. That's how you measure. Number 3 is like also the faith. Because I believe that not just the physical help, but the faith in Jesus. Because Jesus is the one who has the whole solutions for them.
True.
Yeah, I think that's how I measure. And then also the change that I see in children a lot, coming on them, seeing them, how different they're playing.
We've talked about women and children, and even as we wrap up on that segment, what misconceptions do people have about marginalized women and children? Like, what is this idea we hold that is really not the case?
I think like most of the time that like marginalized people, people think that they're looking, that's just like they're asking something from you.
Okay.
That is a wrong misconception.
Yeah.
They are human beings that need just to be reminded that they have something in life. God has created them in God's image and likeness.
Yeah. And kindness and compassion is quite free. To feel like you're extending it and giving it in terms of a hand does not make sense. You should be kind to one another. We should be compassionate to one another. Plus, these people were born and raised in a different area from you. It doesn't make them less human. It just makes them a bit disadvantaged.
Exactly.
Yeah.
That's the same thing. I've gone sometimes. My friends, I think like, you don't look like you come from Turkana. You know, it's like, how do
when you have to look like, okay, valid. No, it's like even when you say, when someone tells you don't look Maasai, they expect Maasais to walk with their cultural attire and everything. So when you tell me you're a Maasai and you're not wearing, I'm like, you don't look Maasai. Okay. Since you're a man, let's talk about the men you've worked with. There are men you've had to empower from marginalized communities. We mostly look at women and children because women and children are key, but men are also equally important. Are there men you've helped?
Yes, I have.
Yes.
Like in that program, I have like 5 men who've been able to come into our every Saturday or every month we meet with them and talk with them. But I work among them. There are like, I have like 5 men who come into those places. There was one who was struggling to start up a business. So I raised again money to give to him to start up a business.
Wow, Isaac.
Yeah.
Yes, that's nice. That's nice. What are some of the practical programs that Pendo Kamili works with? What are your practical initiatives? I've had the Saturday one. We have Saturday one. Yeah. We also wanting to pay school fees for those children because we want to retain them in school. Yeah. Because not only just coming them in on Saturday and sharing a spiritual program, but we want to pay them to go to school. It costs about 3,000 shillings to pay for every student to retain in school, because when they go to school, then they have a future like myself to become myself. They can see the vision you have.
Yeah, exactly.
That's nice.
Number 2, we're also inviting people to a medical camp, because healthcare is one of the difficult issues in the slums, because the lack of access, lack of medical facilities, lack of resources. We invite people for medical camps where the families can be able to get free medical camps.
Yeah. So let's talk about the practical empowerment. That is now what you've said, offering education to the children. How do you support children who are not yet, I don't want to call them children, maybe I should call them young adults. How do you support young adults who have finished the academic part and are now trying to venture into a career? How do you support them education-wise?
So one, we do a program whereby we bring what we call X-CAN program, where we do capacity building. I think like we provide skills on transition programs, career awareness,
career programs,
whereby it prepares them to see beyond just, because most of the time in the disadvantaged communities, people graduate from school, but the family say it's done. Life is not there. It is just beyond just that. And then above that, again, we give them life skills programs, like maybe helping to train them. My wife is a baker, so he comes and trains them in baking, and then try to introduce other professionals who can help and provide support to them before they do that transition. So education aside, there's healthcare, and there are definitely healthcare challenges. How do you address them in these communities? Majorly is awareness. That's what the major part of it, because currently we don't have a medical facility area, and then maybe bringing about the professionals on medical health care and who can come and educate them. We make referrals where our resources can be able to help, and where we get issues. But on like HIV cases, we majorly a lot do counseling, and then again referral has been my greatest win.
Because you're also not a doctor, so you need to have doctors in your team so that you can be able to push the healthcare service and all that. And if one is unwell, do you chip in as well and get the medication? Do you have a program for that, or it's the referrals that you've spoken about?
Majorly, our resources cannot able to allow that, but they are
sustain that. It's going to be a lot.
So what we do is we majorly sometimes just raise the needs with friends or believers, and then those who are willing to support, then they can majorly like say they will support this one. I just raise needs to friends through WhatsApp group, tell the needs about healthcare, the needs of the families. Then those will come. Like Ibrahim was supported by someone else, not myself. Yeah.
Wow. And you're working with, I'm trying to imagine the workload of all this. You're working with 55 families that you know and can mention, and there are those you've worked with and are not part of the 55 families, right? That's a lot. To listen to every problem, to be there for every person, to do all this as one man, Ningumu. So maybe take us through a typical day in your life as executive director. What happens?
Okay, well, I think like majorly one, developing plans. That's the key thing of as a executive director, you develop plans. Number two, I work with majorly a lot of volunteers because I mobilized the community, like the people who are cooking for the children are community members. I ask them to, I don't pay them, they volunteer. So majorly it's actually managing the team itself as like inspiring them and without any kind of salary, and then majorly apart from that is the component of visitation. There's also a component of partnerships, trying to build partnerships with others, as in like trying to talk to Kerubo and see if we can get more support.
Yes, please, yes. That is a whole to-do list.
To-do list.
And you manage and you do this in 24 hours. They give you an extra 5 hours when we are not looking.
Not really.
Not really.
It's the faith.
Jesus
has given me the strength to do this. And waking up in the morning, it inspires me to do this. And it's not a job. To me, it's a ministry.
You've mentioned it's service from the heart.
Exactly,
From humble beginnings in Turkana to changing lives across the country. That is amazing. You show me that pain can be turned into some purpose.
Exactly.
Let's take a short break. When we come back, we'll talk more about faith and empowering young people. Karibu sana. Okay, sorry. I was caught up in between. I forgot to say it. Let's take a short break. Poleni. So from humble beginnings in Turkana to changing lives all over in Nairobi. That is amazing. You show us that pain can be turned into purpose. Let's take a short break. When we come back, we're going to be talking more about faith and empowering vulnerable communities. Stay with us. This is The Nest.